Good evening, everybody, and welcome and thank you for being here tonight on our TIF Talk Tuesday. We've got special guests here tonight. As you can see that we've got a couple of patients here with our physician. So let me introduce our physician first. We've got Dr. Peter Janu. Thank you for being here, Dr. Janu. He's right in the center. Dr. Janu is a surgeon with a special interest in heartburn and reflux disease, as well as minimally invasive laparoscopic techniques, endoscopic surgery, robotic surgery, nutritional support, and hernia surgery. Dr. Janu developed the region's first Reflux Center of Excellence and has served as its director since inception. He has received national recognition for minimally invasive procedures for the treatment of heartburn and reflux and has been teaching and proctoring other physicians both nationally and internationally. Dr. Janu joined Fox Valley Surgical Associates in 2019, serving patients in Northeast Wisconsin for 50 years. Fox Valley Surgical Associates has developed a reputation for providing exceptional medical and surgical care in the latest surgical treatments, care techniques, and technologies. Dr. Janu has been a lifelong Wisconsin resident since his family moved from the Czech Republic to Milwaukee 50 years ago. He speaks Czech, but with an American accent. He has 3 sons and enjoys biking, sailing, and skiing. He's also a so-so golfer, so I'm told, but still enjoys playing and loves watching the Badgers and the Packers. So welcome, Dr. Janu, and thank you for being here with us tonight.
Thank you, Andrea, and thank you for setting this up, and thank you for everybody who's taking the time to watch this event, and hopefully it'll be a good learning experience for those that are interested in this.
Absolutely. Thank you. And we've got you 2 special guests here, 2 of your patients. We've got John. Welcome, John, and thank you for being here. And we also have Kevin. So thank you, Kevin, for being here as well. And then just for anybody that is watching, they all have been tested for COVID, and they are within kind of that 6 feet distance apart. So they're taking all the precautions necessary at their location. So we just wanted to make sure you guys knew that. In addition to that, this is a live event, so if you are watching and have a question at any time for either Dr. Janu or the 2 patients, John and Kevin, please feel free to type your question in the comment section, and we'll do our best to answer all the questions this evening. So thank you again all for being here tonight. My name is Andrea Millers with Endogastric Solutions, and we're going to go ahead and kick it off with you, Dr. Janu. Can you kind of explain to us what is GERD and acid reflux, and what could patients potentially suffer from? What kinds of symptoms would they suffer from if they were suffering from GERD or acid reflux?
Great question. It's a very common problem that people face, and basically it's the issue is related to the content of the stomach going the wrong direction. Normally when you digest food, as things go into your stomach, it's supposed to stay there. But for reasons that are more than likely related to anatomical stretching out or valves getting a little bit weakened, the content of the stomach can begin going the wrong direction. And the stomach is designed to hold on to it, but the esophagus, which is the tube that connects your mouth to your stomach, isn't. And when things go the wrong directions, people can develop symptoms, things like heartburn or chest pain. Sometimes people will get problems with coughing or a sore throat, clearing of their throat, hoarseness, all sorts of things that can be related to the fact that the content of the stomach is going the wrong direction. And normally when that happens, one of the first things that people will try to do is to take some medication to try to offset some of those symptoms. And the medications can not only potentially have side effects, particularly if you're taking it long term, but in many circumstances it's just simply covering up some of the symptoms because the content could still be going the wrong direction and potentially causing damage, leading to either ulcers or even strictures, or perhaps even increasing risk of developing esophageal cancer.
Okay, thank you for that. And what types of symptoms, John, and Kevin, I'll let you go first, John, were you feeling, and how long had you been suffering from GERD?
Well, I don't really know an exact date when it started. but over the past year, I more and more was regurgitating food, and I'm like maybe I'm not chewing it enough, or maybe I have an upset stomach, and so I sort of ignored it. I wasn't having any real pain until the beginning of August, and then I came down with a very sore throat, and that I wasn't sure what it was, if it was allergies or if it was COVID or something else, but it continued for the month of August, and it got worse and worse. And so when I finally went into my regular physician, he recommended that they scope my throat and find out what's going on. And at that point, I still wasn't quite sure. There were different options or different things were being told. And a good friend of mine said, well, you need to go see Dr. Janu, because he'll be able to sort it out and give you your best recommendation. And that's what I did, and everything turned out very well.
Oh, perfect. Wonderful. So we are having a little difficulty. I'm getting some feedback from people that are watching in hearing. Maybe if we have you guys separate a little bit, and then when you're talking, we can just take our masks off. If you guys are comfortable with that, and then
okay.
Yeah, that's okay. That would be great. It's so important. I just want to make sure that they're able to hear all of you guys and your stories. So you had, John, your procedure done in October, is that correct?
Towards the end of October, I think it was the 26th of October.
Okay. And were you suffering from, were you taking any type of medications for your GERD?
Not initially, I wasn't. And then different types of calcium type things, just trying to ease that. But in the time, I went through all types of feelings. For some reason, I thought I had cancer, or that I had Barrett's esophagus. A lot of things I was just looking up and not really understanding very well. And unfortunately, I went through a lot of misdiagnosing myself. I would get extreme pain, and I imagined I was having heart attacks several times. So it really was a panic situation that until I found out more really what was happening.
Yeah, it must have been quite frustrating too, during this kind of COVID pandemic as well. Is this have something to do with that or whatnot? So thank you for that.
It caused extreme anxiety.
Yeah.
And in fact, I still, even though it's all done with, I'm still dealing partly with some of the anxiety that started way back when.
How are you feeling today now that you've had your TIF procedure? Is it a little bit better? I know it's just October that you had it, so you're still in the healing process, but how are you feeling today?
I'm feeling good about the whole situation, and feeling good about what I'm eating and how I'm eating. And through it all, I lost about 25 pounds.
Wow.
Either through not eating, when I found out something was wrong, assuming the worst, I had a 180-degree change in my entire diet. And then I think with stress, I also added to that. And now I think I'm down, not that I wasn't at a healthy weight, but I'm down to a weight that I probably should have been at, and working on a good nutrition plan, selecting the diet that fits well with recovery here.
Wonderful. Thank you. I appreciate that. You can put your mask back on. I'll ask Kevin. Kevin, tell us a little bit more about your story. You also had your procedure in October, correct? Okay.
Correct.
Yeah, go ahead. How long were you suffering from GERD symptoms?
My symptoms were easily ignored until roughly January or February. I would take a Tums, I would take maybe an Alka-Seltzer, and they would generally go away. After January or February, I noticed subconsciously, I noticed that I was buying more Tums, more Rolaids, more antacid products, and using more of those products. And when I reflect back on it, I think I should have been more aware that things were headed in the wrong direction. It just, for whatever reason, it didn't register. I was eating what I would call a Wisconsin diet, which is unfortunately a little heavy in cheese, meat, probably not enough vegetables, and not enough balance in my diet. And as we got in our lockdown here in the state, I found that my eating unfortunately did increase. And shortly after that is when I had a very violent episode in my chest. I had what I would call almost like an esophageal spasm, where I was actually driving on the road and almost lost control of my vehicle. It was so violent, and thought I was actually needed to call 911 on the side of the road. I thought I was having a heart attack. I immediately thought that I was possibly, infected with coronavirus because I had such a sore throat. I had sweating, chest, my chest was heaving. They said, no, it was not a heart attack. It was everything checked out fine. My heart was fine. I did go to my family doctor. He said it was definitely esophageal in nature. He thought it was tied to my stomach acid right away. He recommended that I come to Dr. Janu, that I see different specialists, have tests taken. That did unfold during the summer, multiple stomach and esophageal testing. We did, with Dr. Janu's help, did discover that I was definitely in need of the procedure. So I, with the side effects, the symptoms that I was having, very much loss of sleep, a lot of pain, frankly, quite a bit of anxiety, like John said, not knowing where it was all going to unfold in the middle of a pandemic. We did decide to have the procedure. I was familiar with an earlier iteration of the procedure. My wife had that procedure 25 years ago, so I was somewhat familiar and did decide to go ahead in October, and so far my recovery has been very, very good.
Wow. Wow. Gosh, thank you for sharing. Thank you both for sharing your story. Dr. Janu, that sounds pretty common, both of them, saying that they felt like they were having a heart attack. That's a real common symptom where people feel like they're having a heart attack.
If anything, it's the most common reason why people come into the emergency room with chest pain that aren't actually having a cardiac event.
Right.
So it's very typical for people that have that heartburn because it's the most sensitive area when acid is going the wrong direction. I have patients, imagine if you took the content of your stomach and just poured it on the back of your hand 3 or 4 times a day, that would certainly cause a lot of pain and soreness. And that's basically what's occurring on the inside.
Right. Right. So Dr. Janu, before we get into what the TIF procedure is, what do you generally recommend patients to do to manage their GERD symptoms, in the sense of, are there lifestyle modifications they can do? Are there, do they just, stay away from the foods that they're normally, eating, food aversions or whatnot? What do you normally recommend?
Great question. Yeah, I think the issues that people have can be quite a spectrum. It's not just a one-size-fits-all kind of disease. I think for patients who come in and complain that they're having similar symptoms because they're eating an entire pizza right before they go to sleep, doesn't mean that I need to operate on them. I think it just means that they should probably stop eating an entire pizza before they go to bed. So there's certainly some lifestyle and diet controls that people can modify to make things better. Ultimately, if there's less that's in your stomach, the less that could go the opposite direction and cause those problems. And so trying to eat healthy, eating smaller portions, maybe breaking up meals into smaller, more frequent meals will help. Gravity can sometimes help too, because when you're lying flat after your stomach is filled, it's just easier for things to go the wrong direction. So elevating the head of people's bed can help. And certainly eating healthier and trying to maintain those lifestyles, because your body is trying to tell you something that it's not happy with. And ultimately you have to kind of respond to that message and try to figure out what it's trying to tell you.
Right, right. Thank you. Dr. Janu, can you tell us, today, what are the different treatment options for GERD?
Sure, that's a great question. Reflux has been occurring for many, many years. The traditional type of surgery is what's called a fundoplication or a stomach graft surgery. And this was developed in the late 50s and early 60s as a way of creating a higher pressure zone around the end of your esophagus if that valve has gone bad. And it was typically done through either a large incision in your belly or even a large incision in the chest back then. There was a lot of debate among surgeons as to which way was the better way to do it, but ultimately it involved changing the shape of the stomach, wrapping part of the stomach around the end of your esophagus, so that when the stomach fills up, that part of the stomach would fill up and pinch in. That surgery went away for almost a decade when people said, well, why don't you just take a pill instead of having this big surgery done? But when people realized in the mid-90s that you can do surgeries through smaller little incisions, there was a resurgence of doing this surgery, and it's very effective, but ultimately it has some potential for these side effects. Namely, sometimes people would have trouble swallowing because it would be a little bit too tight or full. Sometimes because it's held together by a seam of stitches, if those stitches get pulled on, people can be sensitive to it and they're left with an achy pain that they didn't like, or it would try to unravel. And based on its design, it just makes it harder to vent your stomach or belch. And so the outcomes of this surgery were based on how bad was the symptom before the surgery and what were the side effects afterwards. If it was like this, then you loved the surgery. If it was like this, it was a wash. And if it was like this, it made it harder for you to enjoy that surgery because the side effects were worse than the symptoms that you were experiencing in the beginning. And so what the TIF procedure allows us to do is a valve reconstruction that's more anatomic, in the sense that we're not changing the shape of the stomach, we're actually just reestablishing the normal angles that are supposed to be there when the stomach is in its proper position. Those angles can get stretched out and flattened, and then the valve just doesn't work as well. And by going through the mouth, we avoid some of the incisions that would be required with some of the traditional fundoplication procedures. And rather than going all the way around and creating this one-way valve that leads to some of the side effect symptoms, the TIF procedure allows us to go about 300 degrees around. So it's a partial valve that allows for a little give or flex so people don't really have the swallowing problems that would come with traditional surgery. And because it's anatomically normal, it would allow you to vent your stomach. And rather than having a single seam of stitches that would potentially be symptomatic and pulled on, we typically put in somewhere around 30 stitches in that partial circumference. So they're more like rivets in an airplane wing that are distributed. And they're placed while the stomach is inflated, so they're already at their tension point, so they never get pulled on. So the benefit of a valve reconstruction with the TIF procedure is that it has a very, very low side effect profile, but it's equally as effective to the traditional fundoplication types of procedures.
Yeah, wonderful. So, John, when you first, went to go see Dr. Janu, how did you decide that, the TIF procedure was the right procedure for you? Was that something that Dr. Janu recommended to you? Did you do some research prior, to you learning about what was going on with yourself?
Well, he has an excellent website that has all these different options explained. And so we initially talked actually over the phone about my situation and sort of how desperate I was at that time and, what I thought were heart attacks and things like that. And he said, before anything else, before we even meet face to face, go on to my website, check out, see what the options are, read about each one, so that you can be familiar when we sit down and talk about it, which ones might be best for you. And we did that. And then he also went through a series of other testing and looking at my swallowing and how much reflux I actually was having. And then it just seemed like a no-brainer at that point. It seemed like that was the thing to do. And I said, well, I trust you. I think that, you know, you're a great doctor from everyone I've heard from. So you don't really have to ask my opinion, but I would have the same opinion that you have, that this was the way to go to solve my problem.
Fantastic. Thank you. And then Kevin, for you, was it the same situation when you came to see Dr. Janu? Did you do much research prior to everything as well, or?
I did. I looked, like John said, I looked on the website. I did some internet research. I saw that it was a newer procedure versus the one that I spoke a minute ago, my wife having a number of years ago, that it was an updated version of that procedure, that the side effects were much less than they were in days gone by, that my situation seemed to be very conducive to not, having any lasting effects, healing quickly, that my diet, while obviously changing after the procedure, would be able to return to normal, that I would be eating, in a relatively short period of time, solid foods and so forth. I thought, given my situation, that was ideal. The fact that the last month before I had the procedure, my pain was noticeably greater. My discomfort all around was more significant. The last 4 weeks before I had the procedure, that at that point, it really did make sense for me to go forward, have the procedure, recover, and then slowly introduce foods and begin eating, back to what I would call normal again.
Yeah, wonderful. So we thank you for sharing that. We've got actually quite a few questions that have popped up. So I'm going to try to go through some of these questions and see if you guys can answer them, and then we'll continue discussing the TIF procedure a little bit more. So we've got we got Frank is saying, hi, I had the TIF procedure done last Tuesday, and this is actually in the London clinic, so he's actually abroad. And a week later, I still have the cough. Is that common, Dr. Janu?
It can be, particularly for issues related to cough, for a couple of reasons. One is that reflux can contribute to cough, but it might not necessarily be the sole reason why people are having coughing. Sometimes people have issues either with sensitivity to environment or side effect of medication, sensitivity to food. And so it's possible that the reflux aspect is corrected, but the cough might still exist because of other factors.
Okay.
The other thing that sometimes people notice, especially very early on following the surgery, is that there is a decent amount of swelling that occurs from the surgery. I'll tell people it's a little bit like having your tonsils taken out, if you can imagine that. And when the swelling occurs, it gets a little bit narrow. The insides would look more like a funnel. And if things aren't passing through the funnel as well, it can kind of pool and feel like it's a little bit stagnant. And that aspect of it can still contribute to the coughing, depending on the sensitivity issues that the cough arose from in the first place. As that swelling goes down and things start clearing through a little bit, if it's truly kind of the reflux issue or things not moving through as well, then the cough should improve with a little bit of time as well.
Great. Thank you. Another question from Burhan is asking, what are the long-term issues related to the use of PPIs?
So PPIs are the medications that block your body's ability to make acid in the first place. These are the medications like omeprazole, pantoprazole, Prevacid, Prilosec, Nexium, Dexilant. These are 24-hour medications, so they build up in your system and then block the body's ability to create that within the stomach. It would typically cut the acid down to about 2 to 3% of what it's supposed to be. And they're relatively safe. They're designed to be taken short term to treat esophagitis. One of the potential issues that happen when people are taking it longer term is that because it's blocking your body's ability to make acid, certain things might not absorb as well into your body, primarily calcium. Calcium needs to be in a certain acidic state to absorb properly, and if you're eliminating all your acid, sometimes the calcium supplements or whatever you're ingesting through your food won't absorb properly, and it potentially increases your risk of fractures of your bones long term. The other thing is that acid is a very effective killer of bacteria, and if there's no acid there, if you eat something, that bacteria can get into the system and throw off the balance of how your body's able to fight off infections. And these medicines are typically filtered by the kidneys, so it does have some impact on how your body's able to filter, and it potentially affects your kidney function long term. There are some potential side effects or consequences that are more associative as far as impacts on the heart or for dementia. Those are a little bit trickier because those are based on population studies. But nonetheless, I think what I find with patients is that if the medicines are helping you and you're comfortable with taking those medications, they're a very good solution for management of the symptoms. What I find is that, and if you look at the studies, anywhere up to 45 to 55% of patients are still dissatisfied with how well the medications are controlling their symptoms, because you start noticing the regurgitative or content aspect of the reflux rather than the acid component. Because I think one of the misconceptions of those medications is that they actually treat reflux. If you listen carefully, they treat the symptoms of reflux. All they're doing is taking the acid away so that if the content does go the wrong direction, it might not burn and sting as much. It typically is still occurring, and that's when people can start realizing that regurgitative aspect or the clearing of the throat, coughing, more of these extra esophageal manifestations that are a little bit higher up. And that's more of a content issue rather than a composition issue. And the people that find me are bothered primarily by the content issue because that's more of a valve reconstruction issue. It's more of an anatomical, mechanical barrier problem.
Right, right. Perfectly said. Thank you. We've got a comment from Laura. She said, I had a hiatal hernia repair and TIF procedure, poor outcome at another facility back in October. My EUS and LES are now perpetually open to 20 millimeters. Is a TIF redo a possibility, or am I destined for a Nissen?
So it's a great question. Everybody's a little bit different, and what I would say is that it's a possibility to be redone. The question is, why did it fail in the first place? The hiatal hernia, which is the passageway that in the muscles of the diaphragm that the esophagus has to go through to get to the stomach, could potentially be the issue. That passageway is called the diaphragmatic hiatus. It's Latin for a hole in the diaphragm, and that's where the term hiatal hernia comes from. And if that passageway is stretched out or widened, if you try to reconstruct with the TIF, then if that hiatal hernia comes back, then it pulls on the stitches of the valve, and you potentially risk the issues that you're experiencing. If the hiatal hernia can be reconstructed, then reconstructing the valve with the TIF is an option. It's possible, based on anatomy and physiology and how your body heals, that a better approach might be to, rather than do a full fundoplication, do a partial fundoplication, which is similar. It's kind of a hybrid in between the reconstruction endoscopically with the TIF versus a full fundoplication like a Nissen, because it might afford the same type of improvement, but in that sense, you'd be able to fix the hiatal hernia at that time as well. For patients who, let's say, over time, the valve becomes a little bit looser or a little bit floppier, just like age always wins and tissue has a tendency to become that way over time. If there's not a hiatal hernia that's recurred, then the valve can still be redone or reconstructed with a TIF, and that gets people back to a similar control of their symptoms that they were having when they initially had it done. But I would probably talk it over with the physician and see kind of what the factors were that led to the failure, because that's a relatively early failure that occurred, and it's possible that it's just some issue with healing that might need to be addressed in a different manner.
Yeah, that's a good point. So, John, did you have a hiatal hernia repair as well, or just the TIF procedure?
No, I had both.
Okay. Okay. And how about for you, Kevin? Same or?
I believe I had both as well.
I believe so.
Dr. Janu, did he have both?
I believe so, yeah.
You believe so?
My nurse is nodding yes, so yes.
Okay. Okay. Fantastic. We do, Frank is asking another question, excuse me. Can you talk about diet week 1, week 2, and week 3 post-TIF operation and do's or don'ts? So maybe you could talk a little bit about that, Dr. Janu, and then we can get kind of some perspective from John and Kevin. What's your protocol post TIF procedure as far as the diet goes?
So from a procedural standpoint, when patients come in to have the procedure done, there's nothing that you necessarily need to do ahead of time. For patients that are having a hiatal hernia repair, we'll try to do a higher protein diet to get people ready for the procedure. It makes the procedure a little bit easier, plus it kind of helps, I guess, get you used to a different type of diet that you normally would be eating. Following the procedure, there is some swelling that occurs, and people typically do better with mushy foods. When I first started doing the procedure back in 2010, I started using the term melt in your mouth diet until a patient asked me if that meant M&Ms for every meal. So I had to change the name to just a mushy diet so that in your mind you kind of think that whatever you're putting in your mouth has to be mushy enough to go through a funnel. If it's liquid, it'll go through a funnel. Even if it's liquid, if you go too fast, it'll back up in the funnel. So in general, people have to become grazers to some extent, where you're never eating too much or too fast at any given time, but you're always taking a little bit of something in to make sure that you don't get dehydrated and that you're getting enough calories. As that swelling goes down, which usually occurs within the first week to 2 weeks, then it becomes a little bit less important the what that you're eating, and far more important the how and how much. So if you're eating something and you're chewing it very well and turning it to mush in your mouth, eating very slowly, taking your time and not eating too much at any given time, those are the people that tend to do the best. And that becomes this new normal, that if people adopt that, then not only are you fixing the mechanical aspects of the valve barrier, but you're also fixing the potential components of diet and lifestyle that brought the problem about in the first place. So I try to reinforce that aspect of it, that it's a two-pronged event. Yeah. So typically people will stay for that first week on either kind of a full liquid or a soft, very mushy, liquidy diet, and then gradually add more things in. Typically, we try to recommend avoiding things like pork or chicken, anything that's dry that would potentially get hung up and not go through as well. The other thing that I'll recommend to patients is that breads, or even though they might be soft, when you eat them, they tend to absorb the saliva and swell like a sponge and become sticky, so they don't go down as well. But ultimately, if you listen to your body and you try to be a little bit cautious, if you exercise some degree of common sense, typically people are going to do pretty well. Yeah. For the gentleman, I will typically recommend that there's a little voice in your head that'll tell you if you're doing something that you shouldn't. And men are notoriously poor at listening to that inner voice. And so sometimes you'll need to find another voice to listen to for those first few weeks.
That's funny. So John, it sounds like the diet for you, actually you were saying that you lost quite a bit of weight from the diet. How was the diet? How was it for you? Were there any things that you would recommend other patients eat or stay away from, just from your experience after the TIF procedure?
Sure. Well, I would say one sort of nice thing right after the TIF, and sometimes you think like they're all liquid diet, what am I going to just drinking for 3, 4, 5, whatever days you have. Before that, I was limiting my drinks with all the acid content and irritation. I would not drink anything with acid. Well, I found out like almost all drinks have acid of some level in it. And so I had been drinking water for like a month before the surgery. And then with it fixed, I knew that I wasn't going to get that reaction, so I could actually drink like juices and things like that. It was a great change from having water the whole time before. And so I enjoyed the first few days, and even though it was all liquids, it was different kinds of liquids than I had before, and actually had some taste to them. And then from that on, it was, just like applesauces or puddings or, anything that would go down very easily, and then bit at a time. Seeing what I could add that would be sort of a softer type thing that wouldn't get too stuck together. There was a lot of sort of experimenting with a little bit, learning to eat a lot slower than I had always eaten before. And typically before, and one of my worst eating habits is that I would usually eat just once a day, that I would not have a breakfast or lunch and just have one massive meal at the end of the day. And that was a big adjustment for me now, where I'm looking to eat like every hour, hour and a half or something, just a little something throughout the day, which actually I think is a lot healthier for me through all of this. Not just the fixing of the problem, but probably a changing of a lifestyle that is going to be very good for me.
Yeah, yeah, and I was watching Kevin just nodding his head. Yes, 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 Kevin. It seems that it was pretty much the same experience for you as well. Same food. What was your experience like?
It was, and what John said was very similar to my situation. I did exactly the same thing. I ate very little for breakfast, very little for lunch, ate a large meal at night for supper, and then experienced those symptoms, obviously. So after the procedure, I had done exactly the same thing. It was a very liquid for really the first week. I had juices, mainly water. I slowly graduated to eating pudding, eating plain yogurt or vanilla yogurt for a number of days. Finally, after roughly a week and a half, I went to broth and having chicken and beef broth. I did that every night for several weeks, actually, probably 2 to 3 weeks. I did just maybe yogurt or a pudding, applesauce during the day, and then at night I had beef broth or chicken broth. That seemed to really get me back on track or feeling much better. And so then after that, I graduated to, softer soups. I also have done, things like additional fruits, maybe really soft fruits, like maybe a small banana slice. And I'm slowly working it up, every week, several days to a week. I'm introducing a new food. I'm introduced just recently. I did half an English muffin, and yesterday I did a half of a bagel, although I did pull back on that after I did that. So you can only go so far, so fast, and I'm taking things slowly, and I believe that's going to, long term, that's going to be of benefit, especially incorporating it with other diet changes, trying to eat more chicken, trying to eat more turkey, maybe less beef, less pork, and things like that. So I realize it's not an immediate thing, but it is a long-term thing. You're definitely looking long-term in this.
Yeah, yeah, thank you.
And also, there's a lot of foods I found after a couple of weeks that I wanted to try and eat, but maybe like I love fish, and it was sort of flaky, so I took a piece and I could feel that it was not going down like it should have gone down. But rather than not have the fish, my wife just said, well, let's just puree it. And we could have a pureed sort of fish meal that was like heaven for me to taste, one of my favorite foods, but yet it worked with how the diet. So I think you just try it and you sort of see which things are and just chew and chew.
Yeah, yeah. we have a patient question. What about tea and coffee and Coke and alcohol? Are those things, Dr. Janu, that you'd still recommend patients to stay away from, kind of in the initial healing phase, if you will?
Well, following the procedure, we actually recommend that if you find some peppermint tea, as long as it's not scalding hot, the peppermint will actually will help motivate the muscles of your esophagus to squeeze. Warm has a tendency to work better than cold for people, although I've had people say that ice cream works the best for them. So you just kind of have to play around with it and try. I strongly recommend against people that really like their sodas or beer, because the fizz has a tendency to go up to the valve, and it'll cause more discomfort than you think it should, quicker than you think that it should as well. And so that, again, is a lifestyle thing, that the fizzy stuff is probably best to try to completely eliminate from your diet if you can. Some people are very, very devoted to their sodas, and if you let it sit and let the fizz get out of it, then it's okay to take some, but it's typically trying to mitigate the portion sizes. So rather than going to get like a big gulp from the 7-Eleven, you're really going to go down to maybe 3 or 4 ounces if you're going to drink some of that stuff.
Right.
As far as alcohol goes, we usually kind of recommend in moderation. Typically, in the first few days after the surgery, the stomach is still going to be a little bit raw and sensitive, but ultimately over time, people are able to kind of eat what they feel comfortable eating, with the caveats being small bites, chewing their food well, eating slowly, and not eating too much at any given time. So you would be able to have a drink with your pasta for your dinner meal, whether it's a glass of wine or a cocktail. You try to avoid the beer, but again, you're kind of focusing on smaller portions and spreading it out over a longer period of time. That's that kind of lifestyle.
Yeah, I like that. I like how you talk about it being a lifestyle change, not only for GERD patients, but it's good for everybody, right? So can you talk a little bit about, recovery, Dr. Janu? Typically, how long does it take for patients to recover from the TIF procedure, and or if they're having the combined hiatal hernia repair and TIF procedure? And then, are they generally in the hospital overnight? Do they go back to work, or when can they go back to work? What's the protocol normally?
The TIF procedure for us usually takes about 25 to 30 minutes to do if it's just done without any incision. The hiatal hernia repair usually takes 60 to 75 minutes, depending on how big the defect in the diaphragm is. And typically that's done with 4 or 5 millimeter incisions. What I find that the biggest thing that patients experience is some shoulder pain that's usually over on this left side following the procedure. It's an interesting way that your body is wired, in the sense that the nerve that goes to the diaphragm, or when we put the stitches in for the hiatal repair, that nerve runs next to the nerve that goes to your shoulder, and your brain interprets that pain sensation, and it says it's probably not my diaphragm, and it makes you think that you hurt here. That pain typically improves after about 2 or 3 hours, such that people are able to go home. So all these procedures are typically done as outpatients, that you go home the same day, unless there's other factors that would involve, and it's more just other medical conditions that would potentially necessitate patients staying in a hospital, but typically only overnight, so it's still considered an outpatient. The pain in the shoulder can linger even up to a couple of weeks. The typical patient would say that they feel more tired than they think that they should feel for the first week after the surgery. Plus, you're trying to adapt to the diet and change things and whatnot. So people will typically stay off of work for about that first week or so. I try to encourage patients to walk as much as possible. Anything that's light aerobic is fine. So if there's a treadmill or a stepper or like an exercise bike, those things, as long as you're not going too crazy. But you want to try to avoid anything that's a core effort, crunches, Pilates, doing weightlifting. For us here in northeastern Wisconsin, I encourage patients that if somebody asks them to move their ice shanty, that they have to say no for a period of time. Typically, you try to avoid the heavy lifting for about 4 weeks or so, because the scar tissue that develops gets to about 70% of its strength at 6 weeks. There's very little at first, but between 4 and 6 is where it really ramps up. So if you're able to kind of allow your body to heal and generate some strong scar tissue, that scar tissue is what ultimately is going to determine the strength and efficacy of the valve and its durability over time.
Wonderful. And for John and Kevin, as far as your recovery, was it pretty uneventful? Was it difficult for you? Aside from the diet part, getting back to work or getting back to your normal daily activities, how was that for you, John?
Right at the same time, I decided to retire from teaching. So
Wow.
I had a very nice recovery, not having to worry about taking care of online teaching and other stresses that were going on. And I could just concentrate on I think, the food issue about eating more often and having the different things, could have been more difficult if I was still in the classroom, because you don't have a chance to, you get your lunch break. So for me, that chance to retire at that time was perfect. And then it gave me a chance to go for hour walks every day too, and just sort of build back, strength and confidence.
Good for you. Congratulations on your retirement.
Thank you.
And Kevin, how about for you? Was it pretty similar? Did you recover pretty quickly or have any issues or events that go on?
No, my recovery has been very, very good. I work from home prior to the procedure as well. So what I did was I took several days, the week of the procedure, the entire following week, and took that off. And then the following week after that, went back half days. And like I said, working from home, it wasn't as stressful or difficult. So I worked half days, and then the following week, returned full time. And that plan worked marvelously. It worked very, very well. I was able to regain, really good fitness or strength, if you will. Taking just a half day for that entire week was really good and allowed me to restore really well. And so my, fatigue and energy levels have not ever been an issue. That it's really recovered and restored really, really well. So I haven't had any problems getting back in the swing of things, particularly with work. And I've slept much, much better since my procedure. My sleep is not as fitful as it was prior. I was waking up multiple times during the night, so that's recovered very, very well. And so because of that, my overall energy level and feeling much more restored is returned very well. So my recovery has been wonderful so far.
That's fantastic to hear. Thank you. So, we're getting close to the top of the hour, or close to the hour. I just wanted to see if Dr. Janu, if you have any recommendations or words of wisdom that you want to leave with people that are watching, that are suffering from GERD. Is there anything that you want to close with or remind people of what they can do if they are suffering, or anything, any closing statements, if you will?
So I think what we were discussing before we started is that one of the reasons why we do these talks from an informational standpoint is to show patients who might have some degree of trepidation as to whether or not they should pursue doing something about changing their lifestyle if they're bothered by things that they're concerned with regards to reflux. Particularly for patients who are taking medications, who are dependent on the medications for their symptom control, or the medications aren't necessarily giving them the relief that they're looking for. There are options available to patients, even though physicians might say that you're just better off taking the medications and whatnot. I think there's a little bit more information now that maybe those medications for cutting acid out aren't necessarily as innocuous as we once thought many years ago. And there are a variety of different treatment options. And so for somebody like myself who kind of specializes in this niche, and I would encourage people to reach out and try to research, because there is a lot of information on the internet that can guide you towards somebody that might be able to help you, because there are physicians like myself, we have a network that are willing to help patients that are looking for this all across the country and all across the world. And the idea is that you're trying to identify the problem, do enough information gathering with testing to truly define exactly what's going on. And then the goal is to match the treatment option that's going to give the patient the most effective treatment and the most durable treatment that has the least amount of risk and side effect. And that's what you're trying to match up. So I encourage people to not necessarily be fearful. There are options available. It does take a little bit of time to define exactly what's going on, because in as much as I do this as my living, everybody's a little bit different. You see, as much as they had similar outcomes and similar procedures, the issues that are involved are all a little bit complex and a little bit different, and individualizing the treatment options to that specific patient, I think, is important.
Yeah, I really like that, the individualized or the personalized treatment option for every patient. And you know, we say this all the time, the reasons why we have these TIF talks are to educate potential patients on what their treatment options are. And as you all, pretty much every physician that we talk to, they say, you know, every doctor is different, every patient's different, and you really should go in, do your research, and then go in and seek some counsel from a physician. So one other item I wanted to just touch on, kind of the elephant in the room, the COVID situation. Interestingly enough, you know, both John and Kevin, you know, suffered at heightened times of COVID, and then also decided to get their procedure done during the COVID kind of situation. Dr. Janu, can you speak a little bit about, you know, the precautions that the hospital, you are taking as your practice with COVID, and kind of give the consumers that are watching an understanding of the protocols that you guys are taking to ensure that you are, you know, staying safe during this time?
It's definitely been an interesting year.
Yeah.
From a healthcare standpoint. I don't think, you know, none of us have gone through a pandemic, so anything that we determine as what we think is a best practice is basically based on information that we learned that week or that day or that month. So it's always evolving and always changing. In northeastern Wisconsin, we are leading the country in rates of infection about a month ago, I think, right? And we were very good and diligent about being cautious about wearing masks. You know, the hospitals are constantly cleaning things. We test everybody before they have any type of procedure done to make sure that we're limiting exposures. I find it very interesting that we have found patients that were completely asymptomatic that tested positive, that we would just delay their surgery for a couple of weeks, but at least they knew that they were potentially carriers and exposing others, so they could quarantine effectively. Right. The benefit of these procedures is that it is an outpatient procedure, so patients typically aren't in the hospital much longer than 4 or 5 hours. And so they're able to go home. You do find out that you're tested. So we try to do everything that we can to make it safe, both for us as physicians, as well as for the patients. I think every location is a little bit different as far as the hospital policies that are primarily predicated on the current state of what's going on in your area. So you have to be a little bit diligent about trying to figure out the timing of things, because ultimately these procedures are more lifestyle procedures. They're not like your appendix is about to burst, and if you don't do it today, you get sicker. This can be kind of timed out to what's going to be the safest for patients. And you want to make sure that you're not going to overwhelm your hospital system by taking spots that would otherwise be best served for patients that are a little bit more sick. So I would just encourage people to kind of look into it from a local standpoint, but I think it's certainly, we felt that it was safe enough to do under this COVID environment with the way that we did it.
Yeah, wonderful. And are you doing telehealth visits as well, Dr. Janu?
Absolutely, absolutely. That's been kind of an interesting kind of addition to a practice where we can reach out to patients that are a little bit farther away or perhaps are a little bit uncomfortable with coming into the office. Or just from a timing standpoint, sometimes it just works a little bit better that if somebody really needs to kind of have some answers, I can sit down for 20 minutes in between surgeries or other patients, and we can just reach out. So you're not necessarily stuck waiting in a waiting room or whatever. I think it's been really nice if people are willing to do it. It is a little bit technology based, but we've been doing it quite a bit now since April.
Yeah, yeah, wonderful. Well, thank you for that. And then, John, are there any last words that you'd like to leave us with? Any advice for other patients that may be watching? Any advice that you'd like to give?
Well, I would recommend really looking into it, give it serious consideration. Everything we talked about today, a lot of positives and very few negatives in the whole situation, and it's solving things long term rather than putting a Band-Aid on something.
Yeah, yeah, thank you. And Kevin, any last words from you? Any advice for the people watching?
Just exactly what John said as well, that it requires a little bit of homework, do a little research, find a skillful doctor, a trustworthy doctor that you're comfortable with, and like we are with Dr. Janu, and ask questions. Don't rush into it without doing your homework, but at the same time know that it is a long-term procedure, and the benefits are definitely there. So I'm seeing them already and reaping them already, which is wonderful. So yeah. I'm very excited about what the future holds and how this has positively impacted my life.
Fantastic. Well, I feel like we need to regroup with you guys, both you, John, and Kevin, and maybe another month or two, and see when you actually get to start introducing your regular diet back in and see how you're doing. So, but so far, I'm very happy to hear that everything went really well for you guys. And then, we can't thank you enough for coming out and sharing your stories with us tonight. With Dr. Janu. And Dr. Janu, as always, we thank you so much for being here and educating the community. If you are in Wisconsin, in Appleton, where else? What other areas do you pull from, Dr. Janu?
In the northeast Wisconsin area, people kind of travel in from quite far away.
Yeah, yeah. If you're from anywhere around there, you can contact Dr. Janu in his practice. His information is on the screen, so you can contact them, set up a telehealth appointment, or even come in and discuss your treatment options for GERD. Sorry, did you say something, Dr. Janu? Oh.
Alyssa's my nurse. She'd be the one that you'd contact and whatnot. So she's very much looking forward to the avalanche of phone calls and people reaching out.
Yes. The avalanche. And I think she's operating the camera too, so she's probably hearing everything too. But if you're not in the Wisconsin area, you can visit gerdhelp.com, and on there is a physician finder. So you can just put your zip code in and or your state, and you will be able to find a physician that offers the TIF procedure as well. So again, Dr. Janu, John, and Kevin, thank you very much for joining us this evening. We really appreciate it. And please stay safe out there, and we'll catch you guys next time. Thank you so much, and have a great evening.
Thank you. Well,
thank you.
Thank you.